Hey, Tim Maria here live, day 2, Digital Health Summer Summit, San Francisco. We have Viveta Lobo, who works in emergency medicine at Stanford, is also the director of Stanford UltraFest. How are you?
Good, I'm well. I'm happy to be here.
So it's great to connect up and to press the flesh and see you in person. Mm-hmm. What is your background?
So, like you said, I work at Stanford. I am the emergency medicine physician over there. And I also do a lot of the work with the medical education, with ultrasound, particularly with UltraFest. We started up last year, and I'm one of the directors for the program.
Okay. Now, why is ultrasound important?
So, ultrasound is, in my opinion, super important. It's it's safe. It's no radiation when you are imaging somebody at work for patient care. Comparatively, it's definitely one of the safer choices. It's totally effective. You can do it at the bedside. It's better for patient care. You are able to make faster diagnosis, treat faster. It just makes a bigger impact. And lastly, it's cost effective. It's compared to a CT scan or an MRI. It's much cheaper. It's comparable, if not superior, a lot of the times as a diagnostic tool. So it's just why not? It's just such a great modality, and it's so underutilized at this point. Totally. I mean, the literature shows that so many clinicians don't use it as much, and as we're developing more progress in how much we can use it at the bedside, that gap is actually increasing and not decreasing. And so, I really want to promote it in use at the bedside, and I think teaching medical students is the key to closing that gap.
So medical students normally wouldn't get ultrasound training in their first year or second year. When did they get the training?
So that's changing. That when I went to medical school, that was the norm. I didn't get any ultrasound training in my medical school, but that's definitely a changing trend. There are some schools out there that are, way ahead of the curve with this endeavor, but what we're doing at Stanford is we're trying to introduce it, and we've introduced it in their anatomy courses as a first year, and now with UltraFest and similar conferences, we're just bringing its power out there. We're showing it, introducing it, kind of learning, having them learn how to use it. It's one of those things that takes practice. It's not something you can sort of pick up for the first time. And you actually have to know how to use it. It takes a little time, and so the earlier you introduce it, I think it makes a much bigger impact for them for a lifelong career, no matter what specialty they use. Mm-hmm.
So, what is UltraFest? Day-long event?
Yeah, so UltraFest is a day-long free ultrasound conference, essentially, for medical students. It was brilliantly crafted about 3 years ago at UCI by Dr. Fox and his students out there. And last year we were able to partner with them and cater it to the Northern California folk at Stanford. It's open to any medical student, and we have last year we had over a dozen specialties, attendings from different specialties come out. They volunteered their time. They spent with the students. They taught them different ultrasound applications across the board. And it's just a fun day. It's a great atmosphere for learning. And we're so excited. We're going to do it again this year in October. We have a date. It's October 18th. It's a Saturday. So definitely, I'm sure we'll have a great turnout again this year.
So can anybody go, or is it just people at Stanford that can go?
No, it's open to any medical student across the country, really. It's a free event. Our website will be up soon. You just have to register for it and show up, really.
So how do people learn more then? I know there's information online, and then how do they reach you?
Yes, you're free to reach us if you're interested in it. If you want to learn more about it, of course, just reach me. You can find me on the emergency website at Stanford, or my email is pretty easy. It's vlobo@stanford.edu.
Okay, now I have a question of, we're learning a lot about the future medicine here at the Digital Health Summit. What is the future of visual medicine, in your opinion?
So the future, I think we're just kind of going forward with digital and technology. So ultrasound simulation is another great niche for medicine. And actually, this year in UltraFest, we're able to bring that into our conference. We're actually partnering up with our simulation folk, and we're bringing it into the conference, which is a novel idea that hasn't been done before. And I just feel like that's the trend of what medicine is going towards. And
so what does that mean, though? Like scanning?
So simulation medicine is where you have a mannequin, which we call our sim man or our sim child or whoever the mannequin is for that patient. And it's kind of cool. It's sort of like a robot that can It's basically simulates the real body. It'll go through different vital signs. It'll have reactions if you do things to them. You can do procedures on them, and it's controlled at the back by this computer system where somebody's sort of controlling. So if you do something good, their vitals will normalize. Versus if you do something not so good, they might start getting sicker on you. And it's a great way to train. It's a great way to learn. So basically, the students will go up. They get a case scenario. Okay, this is your patient. They just showed up into the ER or wherever, and these are the vitals. This is the what they came for, and what are you going to do? And it's a great run on how to go about it. And then at the end, we do like a debriefing on what happened, how could you make it better, patient outcomes, key things to learn. So it's another great tool to learn.
UltraFest will be again. What's the date?
October 18th. It's a Saturday this year. It'll be all day at Stanford. So definitely check us out.
It's a lot of fun. I was at the UCI event just recently, and good time. So that's Viveta Lobo with Stanford and Stanford UltraFest. Cheers.
Thank you.